treatment for alopecia areata varies depending on age, location, severity, and any other medical conditions that might affect the treatment. Good candidates for JAK inhibitors are people who have more extensive disease and have failed other treatments. JAK inhibitors are pills. Usually you take them once, at most twice a day. When someone has hair loss across their scalp and they're not responding to steroids and it's a large amount of hair and/or it's very visible and distressing to them, we will often move to JAK inhibitors. Having eyebrow and eyelash involvement alone is enough to put someone on a JAK inhibitor in many cases. Not everyone, but if it interferes with their life, it's certainly on the table. Once someone's on a JAK inhibitor, you can have immediate regrowth or you can have delayed regrowth. Usually we give it 3 to 6 months to start seeing regrowth. The pathway that causes alopecia areata is overactive, so we use Janus kinase inhibitors, JAK inhibitors, to control the disease. It depends on their comfort level and how much it affects that person, so it varies patient to patient. I have patients that come in that have 50% hair loss and are completely unbothered. And with them, we'll do steroid injections for longer. And I have people that come in with 20% hair loss and they feel like they can't live that way. And then we'll put them on a JAK inhibitor. Before JAK inhibitors, we didn't have a way to target the immune pathway. People were put on medications that you couldn't stay on for an extended amount of time. They often had bad side effects and the disease often recurred. With JAK inhibitors, we can control the condition better and we can alter the dose so that people can stay on low doses for long amounts of time and achieve long periods of regrowth. So insurance is often a limiting factor in getting these medications. You need a physician who will advocate for you. Some insurances consider this condition cosmetic, but most often we can get people covered for the medication. If you're curious about JAK inhibitors, it's important to see a board-certified dermatologist who specializes in hair loss.